Good afternoon, Peter Goertz. I'm a psychiatrist. I'm on call today, and I was called to the emergency room today to see a lady who attempted suicide. Potentially, she overdosed. So there are different aspects I want to talk about briefly today to that type of situation. So if someone overdoses, it can be intentional, unintentional, by mistake, or somewhere in between. There seems to be quite a significant gray area there. So it's often not black or white, in other words, and if someone, for example, if a person overdoses and then right away calls for help, that tells you there may well have been some ambivalence about the whole situation, or even like I described, the patient in an emergency room got up in front of me and overdosed right in front of me. So it's pretty obvious then that the patient did not 100% want to kill himself because he did it right in front of me and in front of the security guard. So it's pretty obvious that he knew that people would help him. On the other hand, he could have died if the medication he ingested was a different medication from what he did ingest. And with the one he ingested, he ended up in the medical ICU. So these things, again, can have various aspects, and people can have their mindset change from 1 minute to the next. So that's another thing. If a person 1 minute wants to kill himself, the next minute they may get a phone call, may feel differently. I was recently, a few months ago, talking with an IV heroin user, and he was chronically using heroin, regularly, intravenous heroin. And when we were talking about it, he told me that when he injects, at least at times, he doesn't really care if he survives. And it can be hard to know if they don't really know the dealer, or if the dealer got a new supply. They don't really know exactly what's in there, what they're injecting. So things can be quite precarious as far as safety, and at least at times this patient told me he just didn't care whether he woke up or not, whether it was an overdose or not. So he was not directly intentionally suicidal, but he was well aware that there's a possibility that if he injected the heroin, he may not wake up, or he may not have woken up. There are other patients who are not suicidal but still can die. So let's say a person is not suicidal but wants to make someone else feel bad, their boyfriend's leaving them, let's say, or vice versa, their girlfriend's leaving them, and they overdose, but they're certain in their mind that it's not enough medication to kill them. If they're wrong, they could die. So that's someone who's not suicidal primarily, but could still die from the attempt. So you have different types of permutations. People often are not, or usually are not entirely suicidal. So there's a big gray area. Some people are quite resolute. If someone sits down with a loaded gun, pulls a trigger, that's pretty clear they're suicidal. But even then, the next moment, if they get a phone call, they may change their mind. So there are a lot, again, I'm telling you in this video, there are a lot of gray areas. Now, people after an overdose, and in general, people will often not tell you the truth. So it's important, if at all possible, to get collateral information, let's say from a family member, girlfriend, boyfriend, child, as far as what actually happened. And that can be a little bit difficult to retrace and figure out. But with the patient today, whom I saw in the emergency room today, the father told me, when I spoke separately with the father, that the patient had recently on and off expressed some suicidal thinking. Not obviously, but the patient knew that other people would construe it that way. So there was some concern in that regard. So that influenced my perspective on the whole situation. And in general, if you're not sure, you want to err on the safe side, and treat any suicide attempt where you're not sure how serious it was as a serious attempt. Thank you.